Well, welcome. Great to have the opportunity to speak to everybody today around an important topic to me as a man, which is men's health. June is Men's Health Month. We're getting to the end of the month here as we record this, but I think it's an opportunity for us to shine some light on the importance of men's health. The purpose of today's conversation is to talk a bit about awareness, begin to focus some conversation about men's health, and specifically, as we're about to hear and introduce everybody, the panelists we have a really great group of people that are subject matter experts on male fertility. And so I think we're going to definitely hone in on that topic more than any other. But just briefly about myself, and then I'm going to pass this off to some of our other panelists. My name is Rob Mordkin. I am a physician. I'm a urologist by training and trade, and I function as the chief medical officer for Let's Get Checked. And certainly this is an opportunity with Men's Health for us to open up conversations about how a man might think about their health and begin to engage in looking at their health and what steps they could take in terms of assessment and kind of on a go forward modality. With that said, I'd love to have everybody maybe give us a brief bio and introduction themselves. Amy Shapiro, why don't we start with you?
Great. Hi, I am excited to be here. So I'm a registered dietitian and I have a private practice called Real Nutrition where I focus on working with individual clients. I work with corporate clients and then I do a lot of different lectures and programs. So I work with a bunch of Dr. Levine's patients to focus on fertility, both men and women, because it is a issue that affects both sexes. And I come from a whole foods perspective. So, really cleaning up the diet, making sure that we are eating nutrient dense foods and working from the inside out.
Great. Well, thank you. I think you'll have some great insight for us. Dr. Schlegel, over to you.
So I'm Peter Schlegel. I'm a professor of urology and reproductive medicine at Weill Cornell Medicine in New York City. I spent most of my career caring for men who have fertility issues and helping them to optimize their fertility. I'm particularly glad that Amy is here because some of the most common questions I get from patients are about nutrition and how nutrition can be used to optimize their patient care. But I've covered all areas of men's health from prostate cancer through to testosterone production, fertility issues, and delighted to be here. Thanks for the opportunity.
Thank you for joining us. I will say, as a board certified urologist myself, your reputation is well known, and it's an honor to have you on the panel. Dr. Levine, let's hear a bit about you as well.
So my name is Dr. Brian Levine. I'm a practicing reproductive endocrinology and infertility specialist, also known as a fertility doctor. I am part of a group called the Colorado Center for Reproductive Medicine, or CCRM, and I oversee our office here in Midtown Manhattan. I've had the pleasure of working with the folks on the two top lines of this, so both Dr. Schlegel and Amy. I have to say I might be a bigger fan of Dr. Schlegel than you because I actually had the pleasure of training at Cornell for 3 years, where he was the marvel and master. Because when someone came in and we talked about those 40% of patients where it's not the woman, it's not the two of them, it's just him. Schlegel was the guy that we reached out to say, well, what gives? So it is a true pleasure to be here today and to have Dr. Schlegel leading it. And I feel like this is almost the hair club for men, but I'm not only a client, but I'm also a fan. But Amy Shapiro both is been an advisor to me personally and for my patients, and so I am so happy to see her here and to be wearing a smaller shirt because of her. So
that's great. Well, good. Well, look, let's just kind of jump into it. And I know again, you're all as I said, key opinion leaders and experts in the area of fertility, and we're going to spend a lot of time, I think, talking about that in particular. But before we do, I want to kind of back up a little bit and just talk maybe more holistically about the importance of men's health. Speaking from my own experience over the last several years clinically, I would say that, in my opinion, the pandemic sort of highlighted a perfect storm between two things. One being that the pandemic obviously limited access for everybody to the traditional paths of healthcare or the traditional paths into healthcare. And then you couple that with men. And as somebody who is guilty as charged, you know, a lot of men are very good about focusing on everything but their own health. Very easy to deny. My wife would call it sweeping it under the rug, but we can certainly look the other way. And so when you combine those two things together, I think that there is certainly a real potential that as we get into 2022 and beyond, that we're going to see a real uptick in some potentially very serious health hazards because men just are not engaging in their health. So to me, that's why this topic of men's health and men's health awareness is really important. But you know, I'd love for the three of you to weigh in on that as well, and sort of what you see, not specifically around fertility, but just generally, you know, in terms of what men's health means to you and how we can do a better job of encouraging people to engage.
So one of the challenges we see is that women are very involved with their health care, certainly from teen years on. And men, Rob, as you said, men often run away from their health issues. And it's only when they get to the point where there's an acute problem, where they have pain or a problem or an injury, or it's almost too late in terms of evaluation. You know, their wife has already, or partner has already been evaluated for fertility issues. And it's only by happenstance that someone does a semen analysis and realizes it's more of a male issue that men actually come in for any evaluation. And fortunately, there aren't a lot of active medical problems that occur in young men, but men don't have a great awareness of how they can prevent longer life medical issues and how they can approach keeping themselves healthy. And that's an area where I think awareness is really critical, so that some insight into those areas is provided to young men and they're able to take more control of their future health and future life.
And Amy, I imagine you see that a lot in your practice. You're not, I suppose, exclusively seeing men that are having fertility challenges, but sort of looking across the spectrum by decade of age and trying to maintain and promote good health.
Yes, so I would say that the majority of my clients are female. However, I have definitely seen an uptick in male clients since the pandemic and during the pandemic. I wouldn't say that I see many men for fertility at the current time, but the conversation comes up when I'm working with their wives. And I would say that most of the time they do come to me, sometimes for weight issues, but mostly when a doctor has given them a red flag. So their cholesterol is up, their triglycerides are high, they have, you know, a high calcium score, something that scares them into actually taking charge and making a change, but never, well, I shouldn't say never, but less frequently, just because they want to make sure they are healthy or they stay healthy. It's more that red flag, now they're scared. So that's when I tend to see most of my male clients.
Yeah, and you know, you commented on a few things that would potentially be red flags, and I think that certainly is something that I want to point out, which is sort of questions around what does it really even mean for me as a man to get checked, and when should I do it? How do I go about it? And so, you know, whether that be, you mentioned calcium scores, this relates to heart health. Certainly there can be screening and should be screening done for colon cancer. We've got on this call 3 board certified urologists, so we're all very familiar with the screening and potential diagnosis and management for prostate cancer. And so, you know, these are all things, and then there's a whole other slew of things that somebody should certainly be looking at in terms of understanding their health and then beginning to follow their health and manage themselves going forward. And, you know, it's not always easy. I would say, and there are a lot of different resources out there. I was going to put a plug in for one of them. There's something called menshealthnetwork.org, which is a not-for-profit based out of DC. And they've got a very nice kind of checklist broken down by decade of life. These are the kind of things you should be looking at, whether it be when's it right to go get your colon cancer screening test done, when should you be looking at blood tests to check for your blood sugar, your kidney function, prostate cancer screening with PSA, et cetera. So I don't know, are there other resources that any of you have utilized in dealing with your clients or with your patients that you have found helpful?
Yeah, so, and just to clarify, I wish I was a board certified urologist. I'm a double board certified OBGYN and reproductive endocrinologist. But I would
we always have room for one more, Brian. It's never too late.
Very happy to train with Dr. Schlegel, though. But what's interesting is the couple will come in and they'll say they're having trouble getting pregnant, and almost without even missing a beat, the female partner will pull up her monosyllabic app, right? It could be Glow, Flow, Clue, Blue, like any of these single syllable apps that have her menstrual tracking. And I'll take that opportunity to say to the guy, so where's your data? And they'll look like a deer in the headlights. And it's interesting, we don't see that men are really tracking even their health data or their biometrics. And I think it's a real opportunity that we carry these incredible devices around us. And there's a chance here to notice gentle trends. And so, we talk about wearables a lot in the office. And if a guy feels like he gained 15 pounds during the pandemic, I'll say, how are you trying to lose it? Or how are you tracking it? Do you weigh yourself every day? Do you use like a Whoop or one of these, apps or products? Yeah, I mean, do you use something? Do you use the Aura Ring? It's almost like none of them are perfect, but they're all enough to remind you that you can make changes that you can actually see yourself. As I'm sure we'll get into this conversation, sexual performance is not sexual and reproductive function. And what we find quite often is that it's the tip of the iceberg when you start to talk to someone about what is your healthy lifestyle interventions that you're doing. Because your wife is tracking everything, really. She's figuring out if she's drinking from a Poland Spring bottle that's made of plastic. She's making everyone in the house drink from glass because of all of the BPA's in there. And meanwhile, you're having hot dogs on the street with your friends before you get home because you don't like her cooking because it's so bland right now. And like these are the conversations that we have to have in the office.
Yeah, you make a good point. I think of it maybe very overly simplistic, but I remember a few years ago at my company, Let's Get Checked, there was a catch line or a byline that was bounced around a lot, which was just essentially that it's good to know. And the idea is, whether you're doing that, in my mind, through wearables, whether you're doing that through access to diagnostics for blood values, urine tests, whether you're doing that through some imaging modality, or certainly hopefully you're meeting with a clinician, a dietitian to do that, but it requires that you actually know. And I guess if I were to sum up, what does awareness mean? It means exactly, you got to get aware. You got to actually lean into it. You got to be volitionally active in taking these steps. And I think that you don't. It's not an all or one. Probably it's maybe a little bit of everything. I mean, Amy, as a dietitian, I know that if I walked into your office, and you probably get this from a lot of people, I would say, what's the one thing I should do, right? What's my silver bullet? What's the vitamin I should take, or what's the fish I should eat, or whatever. And I imagine without answering the question I'm asking you, is you're going to say there's not going to be a one size fits all.
And there's not just one magic bullet, right? It's all of the things to create the healthy lifestyle. So it takes work. It doesn't just happen overnight.
Yeah. Is it a true statement? I mean, I do want us to get into the fertility conversation because, again, I mean, this is a real brain trust right here that focuses on that more than others. Is it a true statement that we're seeing more infertility now than ever before? I mean, is the data there to support that?
Well, it's interesting. There's some very good data that sperm counts appear to be dropping in Western countries and actually dropping to a fairly precipitous degree. What we aren't seeing is a real epidemic of male infertility, certainly not severe male infertility. So it hasn't gotten to the point where it's reached a problem level. But when you couple together couples together planning to have children later in life with any changes in sperm count or any changes in sperm quality, and you have a real problem with couples then being faced with challenges that often they could have had children in the past, particularly if they started earlier. Now they're not seeing it. And they're both interested in what they can do to help themselves be healthier and have less of an infertility or medical problem, and also what sort of assisted techniques that can be provided, like Dr. Levine provides, that will be able to help them.
Is it true that that there's some of these fertility issues that people may be presenting with at times could actually be a canary in the coal mine? In other words, that their issue that they walk in the door with is, we're having a hard time conceiving, and yet when you start getting into that involvement, that evaluation clinically, that you're finding a lot of perhaps, bigger icebergs out there. Does that happen clinically for you?
It is a big issue. In fact, there's now enough information about that intersection between men's fertility and men's overall health that a group of guidelines, basically a series of experts who look at where the information is leading us, really put together and recommended that counseling, talking about this issue with every couple that comes in where there's a men's fertility issue involved, should also involve talking about his overall health. And I didn't really recognize this until those data came together, and I started thinking about some of the patients that I've had, particularly patients with more severe male factor problems. And I realized several of them have prematurely developed cancers, and some of them died. And really the only clue we had that they may be at risk was their fertility problem that we successfully treated 10 or 15 years ago. But it really was a marker, an indication that they were set up, and men with severe male infertility problems are at a remarkably increased risk of all cancers, not just prostate and colon that are easier to screen for, but lymphomas and other types of thyroid cancers, other cancers in other areas of the body. Increasingly, we now have some genetic tests that could be used to figure out more of where their risk may lie. But frankly, the fact that they had infertility is something that leads us to have better screening throughout your life, and it's critically important.
And Brian, is the same sort of scenario true? I know we're here talking about men's health, but is the same true when you're seeing couples that are coming in for fertility evaluations in terms of what the impact or the potential of the fertility might mean for the female partner?
Absolutely. So, I think what I love about my job is I get to treat sometimes one patient or three patients all at the same time, right? Either the husband or the male partner, the female partner, and the fetus, or maybe it's just the woman who's freezing her eggs. But regardless, it always starts with an initial evaluation. And what we find is that, especially in those patients, for example, who have pelvic pain, women specifically with pelvic pain, they might have been told their whole life that they have IBS or that they're gluten sensitive or whatnot, and not realize actually they have endometriosis, which could actually be causing destruction of their fertility, creating an increased likelihood of having trouble getting pregnant or staying pregnant. What I find fascinating is that over the last 2 years, and I don't know why it started in my questioning, but I ask women frequently if they have pain with their periods, which is a very normal question, or pain with intercourse. And then I turn to the male partner and I say, how about you? Do you have any pelvic pain? Do you have any discomfort? And what's surprising is that you start to learn about how many men actually have pelvic pain, but they didn't know whoever to tell. They didn't know where to go. And they're like, I told my internist. I was like, but did you actually tell your internist? They're like, no, I wasn't sure what kind of exam that was going to lead to. So, I told my wife. But, I think there's going to be a very interesting intersection where the fertility doctor might be the first time that the guy goes with his wife right next to him, and where he gets the chance to actually say, yeah, I actually am uncomfortable frequently when we have sex or in other things in my life, and I need to go see someone. And I think that's where, people like Dr. Schlegel and his team can really treat the patient, the male patient, in a holistic manner, right? We can deal with the issue at hand. We can get sperm, we can use sperm to make embryos. But how do you treat the place where the sperm is coming from?
And Amy, I guess sort of along the same vein to you, is you see people that are coming in, with struggles around fertility or perhaps something else, how often are you actually finding sort of an underpinning or a more global issue that really needs to be addressed? In other words, they're coming in for issue A, but issue A is really more of a symptom or a sign of a much bigger problem foundationally. Is that pretty typical in your world also?
Yeah, well, of course, when you come in and you are looking to do one thing, and even if you just lose, 10, 15 pounds, if you're overweight, that's going to help almost every marker that we can count in the body. So it's going to lower your cholesterol, it's going to lower your blood pressure, it's going to lower your blood glucose. So a lot of times people will come in for cholesterol. Once we change the diet, then weight starts to come off, and then everything seems to perform better. Their energy increases, their stress decreases. Even if we just talk about their sleep, or if we start having them take some supplements that support stress and how their body breaks down food and uses it for energy, all of that will start to, have a cascade effect of once you start to feel better. Usually the first sign is increased energy, which then will lead to other things. So one thing always leads to the other and uncovers certain aspects.
You mentioned something briefly I just wanted to maybe get your insight on as well, which is around supplements. I did hear you say that, maybe improving diet, but it might be supplements. So without going, sort of hijacking the conversation entirely in that manner, I know that obviously supplements are something that garner a lot of attention. It's big business, certainly. A lot of advertisements out there for nutraceuticals, but as a physician, I'm also a little leery that there's no real sort of oversight to the nutraceutical industry. So there's a little bit of natural skepticism on my part there as well, scientifically. How often are you either seeing people that are coming in that have been really supplementing the heck out of themselves, and conversely, how often are you leaning on supplements yourself to bring about therapeutic intervention?
So I find that much like exercise, people like to take supplements because they feel like they're accomplishing something right away, right? If you are starting a health regimen, you want to exercise because you get that immediate feedback, right? Whereas if you're changing your diet, you feel like you're losing some of your favorite things and it takes a while and kind of stinks until you get into the flow. So people like supplements because it feels like immediate gratification and they feel like they're putting something great into their body. My use of supplements is usually to fill a gap. My use of supplements is to, food first is the way that I work in my practice, but many people are not getting enough nutrients from their foods, especially with our soil, how depleted it is these days, where our food's coming from. So I will always have a conversation. There's always an initial consult, and I will always ask what people are eating. And then we'll discuss things that are important to include. So I usually incorporate 3 or 4 umbrella supplements in my second or third session with the client, not right away, because I want them to focus on food first. So vitamin D, as like 95% of us are deficient in vitamin D, omega-3 fatty acids to tamper inflammation, and because most people are not eating enough seafood or those cold water fish that have omega-3s, or snacking on walnuts because that's what they want to be eating. A probiotic oftentimes for those who are, need that. And then those would be my top 3, because those are areas that most people are not getting enough in. So that's how I tackle supplements, even though people come in and they want them. I always lean on they're expensive, let's talk about it first, because it's going to collect dust and you're not going to use it. So we start slow, but we always talk about food first.
It's music to my ears. I tell you, or music, I should say, to the dietitian's ears. We have a dietitian that I work closely with at Let's Get Checked, and one of my favorite sayings that she's taught me is you can't supplement your way out of a bad diet. So that sort of resonates with what I've been taught as well and what I've learned. So I appreciate that insight.
You can't outrun a bad diet either.
Right. Yeah, that's good. Kind of pivoting back a little bit, specifically into men's health, and then I do want to drill down even a little bit further in male fertility stuff. Is what would and Peter and Brian, this is for both of you. What would you say to a man that shows up at, say, age 20, age 30, or let's maybe be a little broader, early 20s, mid to late 30s, early 50s and beyond? I mean, if they said, I want to get engaged with my health, and I'll ask it, and I'll let both of you chime in, but what would you say would be the kind of things that they should be doing besides, taking Amy's nutritional advice and improving diet and things like that, and exercising, staying away from, obvious carcinogens like let's not smoke, let's not drink to excess. I think these are low-hanging fruits. But are there certain diagnostics that you specifically feel are important, certain evaluatory pieces that are important aside from fertility? And then I'd like to hear specifically around fertility as well, but we'll get there in a minute.
Yeah, it is stunning if you sort of think about what Amy has talked about in all of these different areas coming together. One of the biggest challenges is men putting on weight and the adverse effects of obesity. And, obesity resulting in increased oxidants within the body, the oxidative effects and, its translation into cardiovascular heart-related problems, in later cancer problems. Men tend to live a long period of time and they don't sort of have a drop off in their fertility that occurs precipitously like occurs for women, but they're actually exposed to a lot of things over a period of time and they kind of accumulate damage within their bodies, and sperm is one of the areas where they accumulate their damage. And there's probably nothing that makes that damage occur faster or in a more permanent fashion than being overweight. So weight, which preferably is through diet and exercise, you maintain that best, but weight issues are really substantial and they can lead to eating patterns that are problematic lifelong. I could talk more about fertility issues. We'll probably do that later.
Thank you. Brian, your thoughts about sort of what would be the diagnostics or the advice pieces for that, early 20s, mid to late 30s, and then into the 50s and beyond?
So I've been practicing medicine long enough to remember when there was a change in the recommendations for women to not receive an annual pap smear. And there was a lot of pushback, and people are like, if we stop doing annual pap smears, women will stop going to the OBGYNs, and the OBGYNs are on the front line of women's preventative health care. What we found was that even as we changed our guidelines and we took, a little bit of science and the understanding of HPV and whatnot, women still went to the OBGYN on an annual basis. Women actually kept going to the doctor, even if they didn't get that carrot put in front of them, which is knowing that your pap smear is normal. And the reason is because we've created a culture in this society of the annual checkup. And yes, it might be done by the OBGYN, and when patients are going through fertility treatment, it might be done by me who are, while they're in treatment. But what I found is that male partners infrequently go to the doctor without a problem. They'll have a problem, they'll go see a doctor. They'll have a scare, they'll go see a problem. They'll go see a doctor. But I think that for men in their 20s and their 30s, there's this almost invincibility. And unless it's to get Propecia because they're worried about losing their hair, or to get Clomid because their other guy friend in the gym told them that now they're taking Clomid, which their wife took, and now their testosterone's going up and they're having better workouts. You don't hear of men going to the doctor for preventative health care. And so I think if I could redo my 20s and 30s, it would be, I wish I saw the doctor on an annual basis and I was able to track my data of how things looked over the years.
That's great advice. And Amy, what about you? I know, again, we talked about like eating better. Is that it? Start your habits early and stay with them longer? Do you see a drop off or a change in that younger group versus that group that's got a few more miles on them versus that older group that's now maybe re-engaging with their healthcare because mortality means a little bit more to them?
Well, I see now that, the younger groups are more interested in preventative in terms of food. And I think that even with the pandemic, right, wellness has really taken a huge uptick. People are scared now. People had time to research. People want to perform better. They want to exercise. They want to look better. So I see the younger groups are wanting to work on that more. I would say once I start to see 30s, 40s, it's changing old habits, or it's recognizing that now you can't do what you did in your 20s and get away with it. Not that it was healthy then, but you can't get away with it. And the first place that you see you can't get away with it is because your weight is creeping up, or you're tired, or you're stressed. And I do see that the stress piece and the lack of sleep is a very big player in all of the other components. But I would say that it's my whole thing is really just building a lifestyle. It's definitely not a diet, and I know that we've all heard that before, but if you can tell yourself that it's not about never eating another carb again. It's just about being smart about the carbs you eat most of the time, right? It's not about binge drinking. It's about knowing if you're going to be drinking and how to do it. Of course, no one should be smoking, but so it's these things, these lifelong patterns that you want to be able to continue no matter what age you are and no matter where you are, right? Hopefully you're going on vacation, hopefully you have events and all these things coming up. So you want to be able to practice these things and then know how to correct when you fall off. So it doesn't become an event, it's just a moment. And once you understand that moments happen and your life is not going to just be about salads, then we can change your habits and create a lifestyle where everything else becomes hopefully better.
Great, thank you. Let's dig in a bit now on the nitty gritty on fertility specifically, because again, I mean, you guys are all really just world leaders and experts on the topic. And I first thought would be, you mentioned, Dr. Schlegel, that we know that sperm counts are dropping. Should men be worried about fertility? I mean, as a urologist, I think I know the answer to that question, but I'd be curious to get the fertilities expert. I mean, is fertility a big problem out there? The numbers sound like they're probably going up, but should somebody that's just sort of out there listening to this think, oh my God, I must be infertile, I need to run in for an evaluation? And then the next question after that would be, for both you and for Brian, what would that evaluation look like? When should somebody get concerned? How do they begin to express some evaluatory or engage with some evaluatory resources?
Sure. So the increased awareness that more men could have fertility problems and that men's fertility potential does actually start to change even as early as age 25 has led to a lot of pop-up companies where men now have the opportunity for themselves to even be tested at home. Provide a semen sample, it's sent into an online company, it can be analyzed, it can even be frozen for potential later use. The concept being, if you give a semen sample early, those sperm then are frozen, they're protected, they're not going to be part of you acquiring more damage or problems with your sperm as you get older, whenever you want to have children in the future. And so it's looked at as almost an insurance policy. The science behind it is not perfect. We don't know for sure exactly how much increased risk you have over time. Certainly as men get over age 40, there are increased risks of them being fathered. By increased risk, I mean increased risk to the offspring of some either subtle conditions or not so subtle conditions like autism and schizophrenia. So a lot of men are taking advantage of that opportunity to learn more about themselves. Brian, I think, can talk more about sort of standard male evaluation and how he looks at a man in an infertile couple and how that's approached.
Yeah, so, whenever I look at the couple who's trying to get pregnant or may have trouble staying pregnant even, I always say, let's start with plumbing. And the plumbing is both male and female. And for the female, it's making sure that you have 2 open fallopian tubes that open to 1 uterus, and that sperm can have a safe passage up and embryos can have a safe passage down. When it comes to men, I say, look, the best way to assess, the current plumbing is to actually do a semen analysis. And the semen analysis is probably the gold standard at this point right now. The World Health Organization has been very clear in how it should be done and what the normal values are. And I'm sure we can share with our viewers at a later date of literature to go look at this. But what we do know is that for the World Health Organization, there is a set of minimums. And what's interesting is that when you talk to a woman about her ovarian reserve or her egg count, no woman is happy with having the minimum. If you tell them they're, a normal level is at least 0.5, they're like, oh, that's not so good, because if I would have been 0.4, it would have been much worse. You tell a man that he has 2 times normal, which is really not that much, like 30 million sperm per milliliter versus 15 million sperm per milliliter, and it looks like literally he just won the lottery. And so it's very interesting about how you counsel patients about their semen analyses and how you actually advise them to look at it. What I do tell people is that this is a standardized test that's done as a screening test. It is not diagnostic. I'm not going to figure out actually if all your sperm are Michael Phelps or Ryan Lochte, right? He's the one who got drunk and swam in circles and lied in Brazil. But in the same regard, what the semen analysis is going to do is it's going to tell us that, like you said before, the canary in the coal mine, is there a reason that you need to go see someone like Dr. Schlegel? And what we have found quite often is that motility tends to be a very sensitive marker for us. And so when we see an altered motility, which means at least 40% of the sperm have to be motile, 60% could be not swimming so well, that tends to be a real knee-jerk response where we say, you need to go see a urologist. The same can be also for morphology, right? 4% of your sperm have to look normal. 96% can be hideous, and you're normal, right? Like the gross majority, almost all of your sperm can be ugly. You just need to have 4% look normal. But if we see less than 4% being normal, that's another reflex to say, maybe you should just go get checked out. And what we find is that when we actually identify issues such as these through a semen analysis, which again, a relatively easy test, relatively low intervention, and you send someone to your urologist, it uncovers a whole bunch of other things. Testicular pain, discomfort, feelings of tugging or pulling, varicoceles, things like that. And so actually, I'll give it back to the two urologists who are on here to maybe share what those things are, but we start to see that, a simple test can start to uncover other pathologies there.
Yeah, again, it's the notion of the canary in the coal mine. There's no doubt that certainly in my years of practice, we will certainly see somebody who may come in, with fertility as their entry point. It may be something else, but as you point out, there can be some underlying issues, varicocele, which is the dilation of the veins around the testicle, hydrocele fluid around the testicle, or in less common cases, but testicular tumors, which are very rare tumors generally speaking, but as Dr. Schlegel and I both know, it's the most common solid organ malignancy in men between the ages of 18 to 35. So there's not a lot of it out there, but if you're going to get it, that's kind of the time frame you're likely to see it. I don't want to monopolize everybody's time, but I would like to ask kind of in a rapid fire sort of way, if you had one or two pieces of advice that you would provide to a man today, and I think we've heard some of it already, but maybe it bears emphasis, what would it be? What would you like to see them do or not do? What would you like to see them, volitionally get involved in? How would you go about it if they said, I want to improve my health? And maybe it's a softball, Amy, but I'm going to send it to you first.
Mine is nothing new. It's just going to be really to focus on eating more fruits and vegetables, right? At every meal, I recommend that my clients eat 2 cups at least of fruits and vegetables. That's where you're getting your antioxidants, you're getting your fiber, you're getting hydration, you're filling up on all of the good stuff, and then crowding out the bad stuff, which means that there's just less room for it. You're not feeling like you're suffocating or you're starving, you're just filling up on the good stuff. So I would say to eat more fruits and vegetables, plants, and then I would also say to eat more fish instead of processed meats. So everybody loves their bacon and their salami and their turkey and their Cuban sandwiches, all of those delicious things, but let's capitalize on the omega-3s, eating more fish, snacking on, whole foods, healthy walnuts, and letting go of some of the cheese.
Peter, how about you? What would be your pitch?
So as I said before, keeping your weight down, I think is critical. And Amy's just given you a recipe for doing that. I think the other thing that's valuable for younger men is to start to get some awareness of kind of where their risks are. We focus a lot on what we can do, but sometimes you haven't thought that much about what your family history is. And, if a couple of your relatives had heart attacks in their 50s or 60s, don't just write that off to the fact that they may have been a little overweight. Recognize that there may be some risk factors there that you can kind of concentrate more on. Similarly for developing prostate cancer, colon cancer, particularly if those tumors occurred early in other family members, those are kind of clues. And sometimes you may not recognize that. Having a thoughtful physician who goes over that with you, I think can be very helpful.
That's great. Great advice. How about you, Brian?
So my 2 pieces of advice, one is that if you and your female partner are trying to get pregnant or have another child or stay pregnant, it's easier for her to be on the same diet that you're on than for you to be on two divergent diets. So it is just not nice, plain and simple, to be eating ice cream every night if your wife is avoiding all the inflammatory foods that are out there. I think if a family does the heavy lifting together, they can achieve their goal, and it's actually a much more rewarding experience for all parties involved. That means including the practitioners and the providers. And so I think it's really important for everyone to be on the same page about what is the short-term and long-term goals, and to understand that typically what's good for your wife is also good for you. So watch your diet. The second part I'll say is taking testosterone is not how you improve your fertility. This is like a fascinating pandemic issue, and I'm kind of surprised by it, how often we see this, but with the advent of these telemedicine options, a lot of people have taken up to talking to people about their low T and asking for just a little more testosterone so they can get back into their routines and feel better and go to the gym and lose weight. And then all of a sudden the guy loses 50 pounds and he finds out that his semen analysis has gone from sperm to azoospermia. And he really doesn't understand why his sperm count has dropped. And so I'd say is before starting any hormonal therapy, I would say speak to your physicians and maybe even the fertility doctor that your wife is seeing to understand why you're taking that, what the implications are.
Yeah, it's all good advice. And I think my two pieces are going to basically sort of steal from what everybody here has said. I mean, mine is first and foremost, I would encourage everybody to engage in a healthcare resource of some sort. In other words, it's good to know. You need to get involved with somebody who's professional, who has experience and can guide you as to what are the right modalities of the way to live. As you've heard here today, really great advice from all of you, but certainly, also in terms of diagnostics, you can't begin to understand where you need to go if you don't really understand where you are. So looking at some very easily obtained data points around what's your blood sugar looking like in terms of your A1C, what's your cholesterol panels look like, Dr. Schlegel, you mentioned around heart disease and some of this, and that's one big component. Is I just would encourage people to rather than be afraid or not engage in getting data that's their data, they should go out and seek it out. And it's just helpful to know. It helps motivate you to then push yourself in the right direction in terms of lifestyle habits, things like that. The other would be, and I think it's an emerging thing, and it's a topic for a whole other day, but is around some of the genomics that I think are going to be evolving. I think the next 5 to 10 years is going to be a really exciting time in that space, because with the commercialization and a better understanding of the genomics, where we can really begin to get into personalized medicine, understand for Rob Mordkin what may be, based on my genomics, the right diet or the right medications or the wrong medications to be on, and really help to personalize my path forward, so I'm not sort of shotgunning and just throwing a bunch of stuff on the wall and hoping something sticks. So to me, it's going to be those two things. But I really appreciate all of your time. I want to be mindful of it this afternoon, but it's great to have your expertise and your insight as we all sort of seek to try to help people live a better, healthier life. And we hope the men will take this to heart and get engaged in their care. So with that, I think we'll wrap it up. And I thank all three of you for your time today.